The Health Minister has been in Dunedin today, where he reassured people there are enough ICU beds at the city's hospital. Checkpoint has been reporting on a series of postponements and cancellations to scheduled operations at Dunedin Hospital, not because the surgeons weren't available, but because there were insufficient ICU beds to care for patients after surgery. On Tuesday, the DHB admitted on Checkpoint there had been a problem, but said extra beds were being added and would be in place by this time next year. But today, the Health Minister was more confident about the hospital's immediate ability to meet demand.
The hospital here is able to provide the ICU beds that are required.
Jonathan Coleman being unequivocal. The hospital can provide the ICU beds that are required. Full stop. But on Tuesday, the DHB's CEO, Chris Fleming, had been equally unequivocal, although seemingly with a somewhat different response.
I believe that patients' care has been delayed as a consequence of ICU capacity.
You simply don't have enough ICU beds, do you?
Currently, we do not have enough ICU beds, absolutely.
So, 4 days apart, the DHB had said they don't have enough beds and the Minister had said they do. Interpretation is one thing, the flesh and blood reality of an operation being cancelled is another. On Tuesday, Checkpoint spoke to 3 Dunedin families who'd experienced cancellations. 2 had explicitly been told the issue wasn't surgeon availability or theatre availability, but a shortage of ICU beds for post-operative care.
He has been postponed 7 times.
That's Bridget Telfer talking about her dad, Merv. 7 postponements, including twice after he was admitted to hospital.
Yep.
And there was Kelly's 13-year-old daughter, Amber.
Amber's got a lot of things wrong with her. She's actually got microcephaly, scoliosis, cerebral palsy, epilepsy, developmental delay, and she has asthma.
Amber had been admitted and prepped for surgery. Family members had taken annual leave to be there. The surgeons were good to go, but no ICU bed. And then there was Owen Glover, 68 years old, a Dunedin man who'd gone to Dunedin Hospital where there is an acclaimed heart team, but got sent to Canterbury instead and then delayed and delayed. We spoke to his daughter, Donna.
They just kept sending letters saying, unfortunately, your surgery has been, delayed or put off or whatever. It will now be happening on whatever date, But yeah, 4 times it was cancelled.
And the first appointment was February that was cancelled?
Yeah, and then March, and then April, and then July.
And then he died in August?
And then he died at the beginning of August, and they had said that he would definitely be in towards the end of August for the surgery, but of course, obviously, we didn't get that far.
Did Owen Glover die as a result of his surgery being delayed? Could surgery have saved him? Our Dunedin reporter asked the Minister that today.
Yeah, so look, that is always concerning. I've raised that issue with the Chief Medical Officer here today, that specific case. And look, we can't talk about details that would break patient confidentiality.
That was the Minister today. We also tried to get answers about Owen Glover on Tuesday and Wednesday, direct from the DHB. The family want answers too. Has the DHB spoken to them?
I have, and I've made contact with the next of kin we have listed, one of his family members.
That's Dr. Nigel Miller on Checkpoint on Wednesday night. He told us, made contact with a family member of Owen Glover who died in the period after a series of heart operations were cancelled.
And I've made contact with the next of kin we have listed.
So he'd made contact with the family, and that, he said, precluded him from talking to us about the chronology of events around Owen Glover. But, in brief, did he die waiting?
I think my primary responsibility is to speak to the family.
Nigel Miller on Wednesday.
Question number 11, Dr. David Clark.
As we were talking to the DHB, Labour's health spokesperson, also a Dunedin MP, was asking the Health Minister, Jonathan Coleman, about Owen Glover and other patients.
Like Amber Gibbs, Alan Sutton cancelled 3 times, Merv Telfer cancelled 7 times, and Owen Glover, who didn't make it to surgery and passed away in his home after 4 postponed appointments.
The Honourable Dr. Jonathan Coleman.
Well, look, I'm not familiar with those individuals, but of course it is important that surgeries are performed in a timely manner.
So the Minister was unable to talk to specific cases as well. But how were the specifics going? Today we phoned Owen Glover's daughter, Donna, to see how things were progressing with the DHB. Have you heard from the Southern DHB?
No, I have not.
So on our program, they said they were in the process of talking to you about what happened to your father after his surgery was delayed. Is that happening?
No, nothing has happened as yet. I haven't heard from anybody.
Would there be anyone else in your family who might qualify as next of kin for your dad who has heard from the Southern DHB?
There shouldn't be anybody else. No, I'm his next of kin. Obviously, I handled, all his funeral arrangements and payment of lawyers and, probates and everything like that when he died. So I'm the one who obviously should be dealing with anything like that.
We were confused, so our producer Bridget Burke emailed the DHB. On Thursday, they replied, and I quote, "Dr. Miller has spoken to Mr. Glover's next of kin." No name. We wanted to know who. Who had they spoken to? We emailed the DHB again. Who have you spoken to? We explicitly asked. They failed to give us a name. But an hour later, our executive producer, Pip Keane, received a Facebook message from Donna, Owen's daughter, and I called her back. Have you heard from the Southern DHB since we last spoke?
Yeah, I just flicked Pip a wee message before. They have, Nigel Miller has phoned me. He is teeing up a meeting possibly Friday next week. Yeah.
So you hadn't heard from him, and then we made some calls to say, hey, who are you dealing with? And then you heard from him.
Yeah.
Well, that's good that you're hearing from him.
Yeah.
So now the meeting is taking place. What Donna wants to know is why the delays? Why send a Dunedin patient to Canterbury? And if you're sending him away for surgery, why then cancel the surgery?
The fact that Dad was 68, I just don't understand why he couldn't have just had the treatment that he needed. If he was 85 or something, I would have totally understood that there could be, the whole risk factor, everything. And I'm just really sad that he didn't, wasn't given treatment that he needed. I mean, he still would have been alive and able to hang out with the grandchildren, and what if he'd had, the surgery that he was meant to have. So I'm just, some explanations are certainly high on my agenda right now.
And you are going to meet with the Southern DHB a week today?
Yes.
Well, that's the start of understanding what happened, right?
Yes, it's a beginning, that's right, absolutely.
It's Owen Glover's daughter, Donna. Obviously, we will keep an eye on what happens there. Were the delays? There were 4 of them material in Owen Glover dying of heart disease whilst he was waiting for his surgery.